everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a combination contraceptive known as Nuvaring. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Nuvaring is a vaginal combination hormonal contraceptive that works by suppressing gonadotrophins. The primary effect of this action is inhibition of ovulation. It also has the ability to change cervical mucus and make it more difficult for sperm to enter the uterus. In terms of indications for use, Nuvaring is indicated to be used as a method of contraception. Now, before somebody was to use Nuvaring, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If somebody had active breast cancer or a history of breast cancer or other estrogen-sensitive cancers, they would not be able to use this medication. Patients with cerebral vascular disease or coronary artery disease cannot use Nuvaring. This medication will be contraindicated in patients who have diabetes with vascular disease. Patients with a hypersensitivity to any component of the product would not be able to use Nuvaring. It can't be used in patients who have uncontrolled hypertension or high blood pressure. And lastly, patients over the age of 35 who have migraine headaches or who smoke cannot use Nuvaring. Now, in terms of precautions, this medication should be used cautiously in patients who have risk factors for cardiovascular disease. This medication may lower glucose tolerance, especially in patients with prediabetes or diabetes. There's a risk of experiencing a venous thromboembolism with the use of Nuvaring. Patients would be at an increased risk of experiencing this if they were a smoker, if they were obese, or if they had a family history of VTEs. The medication should be discontinued if there's any unexplained vision loss. Patients should be made aware that liver dysfunction may occur, and the medication should be stopped if jaundice occurs, which is a yellow tinge of the skin. There may be an increase in frequency or severity of migraines in patients using Nuvaring. Some patients may experience persistent severe headaches. And lastly, patients should be made aware that adherence to vaginal tissue has been reported with Nuvaring. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Nuvaring, they would use this method of contraception vaginally. The patient would insert one ring into the vagina and it would stay in place for 3 weeks. The ring would then be removed for 1 week, and then the process would be repeated with a new ring. As with all medications, there are some side effects or adverse reactions that patients may experience while using the Nuvaring, so I'll go over some of those here now. Mood disorders are seen in up to about 6% of patients. About 5.5% may experience vaginal discharge. Up to 40% may experience vaginitis. Now, some more rare but serious side effects would be impaired glucose tolerance, disorders of the cardiovascular system, hypertension or high blood pressure, a myocardial infarction or heart attack, a cerebrovascular accident or angioedema. That's all we're going to talk about today with Nuvaring. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.